This next story has been suppressed by mainstream media. Let's go to Andreas for more.
Everybody, tune in to Recent Tartarians.
Recent Tartarians. Recent Tartarians.
Hello. Welcome to the Xirtus. Tune in for another exciting episode of wonder, imagination, and discovery.
Recent Tartarians.
РМР образует всеобщие закономерности, определяющие законы классической физики для нашего
Sometimes I
мира.
look at the moon and just think, your skin's beautiful.
Baby, when I met you, there was peace unknown.
Что касается энергии наномер, то она превышает ядерную в немыслимое число раз – 10 в 74 степени.
That's it. That's it. That's it. With your arms now. That's it. That's it.
Thank you for watching Xirtus. Keep listening. Remember, if you enjoyed the video, please follow and subscribe and share and support. It really helps. Coming up next, Xirtus.
By the way, that's gone. If you didn't record that, that's gone forever. It's gone.
So this is what Aubrey de Grey looks like. And, seriously, here he is. See, it's real life. How's it going? How's it going? Good to see you.
Yeah, I'm delighted that I still look pretty much like that photograph that was taken quite a long time ago.
Well done. I think that's kind of the plan, and we're really impressed. Good job. I want to also introduce you to people who don't know you super well as someone working to defeat death, and at very least to help us defeat age-related diseases. Gennady is also with us from the United States Transhumanist Party. Thank you for making it.
Yes, indeed. I'm pleased to be here.
I look forward to both looking at your research, but also your life. I'd like to ask you a bit about why you're so interested in fighting age-related diseases, and what gave you the opportunity to fight even at all, right? What happened in your education that led you on this path?
So that's to both of us, right?
Yeah, that'd be cool.
All right. So let me start. So for me, I guess I had the right kind of early upbringing to, have a high opinion of myself and to believe that I could do a lot. And, I did okay academically in school, and I decided I wanted to make a difference to the world, which led me to a few decisions. Things like, there's no way in the world that I would ever have kids because that's an extraordinarily time-consuming thing that takes away from other stuff that one might do, and it's something that doesn't make a difference to the world because lots of other people are already perfectly good at having kids. I wanted to do things that very few other people are good at, and that led me initially into artificial intelligence research because I came to the conclusion that I was a pretty good programmer in my teens when I first started trying. Then eventually I decided that I should switch fields, and that happened because I met and married a biologist and met a lot of biologists through her. And the result, what I discovered, my utter horror, that biologists, by and large, were not working on aging. They just didn't think it was their problem. And I said to them, well, it kind of is. You're kind of like going to die and stuff. And that didn't work. So I eventually came to terms with this and decided, well, I've got to switch fields. And that happened about 30 years ago. So that's my origin story.
So it's also interesting, about 30 years ago is when I started seeing more and more push of the Tibetan Buddhist honorable death thing in science, which is a weird place for that, right? All these people that are saying, there's a dignity to death and there's a dignity to getting dementia and dying. It's really weird. That's not the kind of place that kind of logic should emerge, right?
Well, I can say a little bit about that. So I don't think anyone says there's any dignity to dementia. But plenty of people do say there's a dignity to dying or, at least to aging. And this arises from the utterly bizarre misconception that one can meaningfully distinguish the diseases of old age, like dementia, from, quote, aging itself, unquote, whatever the hell people mean by that. There is absolutely zero biological distinction. It's purely semantic, but nevertheless, it's a very deep-seated one. And it is the fulcrum, the foundation of the idea that aging is something that we should somehow celebrate and dignify, and that treating aging as a medical problem, medicalizing it, as they would say, is outrageous, and we shouldn't do it. You know, it kind of undermines the dignity of the elderly. This is definitely, you know, among the most insidious misconceptions that exist in society. Its insidiousness is particularly amplified because it is propounded by large numbers of people with letters after their names, people with some degree of authority, and it's done enormous harm, and it still does.
It's terrifying. And also in terms of research that you're doing, what holds back people from participating or, you know, furthering that? Like, have you felt in your research a lot of assistance with this or impediment?
Well, I mean, obviously, I've done all right over the past 20 odd years. I've brought in a bit of money and got a bit done, but for sure, I could have got a hell of a lot more done with a lot more money. And and that is enormously saddening to me, because at the end of the day, you know, I have to some extent come to terms with this, but at the end of the day, it's all because people are in this thing that I've called the pro-aging trance. They are terrified, absolutely terrified of getting their hopes up and, you know, thinking that there might be any kind of chance that they would benefit from the medical control of aging. And, you know, there's some justification for that, because the fact is, ever since the beginning of civilization, there have been people coming out and saying, you know, we know how to do this, we know how to bring this aging thing under control. And they've always been wrong. So there's a certain degree of justification for, you know, hesitating to believe the next person who comes along and says that. Nevertheless, this terror of getting one's hopes up translates into these spectacularly irrational rationalizations for aging, you know, justifications for aging being some kind of blessing in disguise and all that, or else being like not a medical problem because it's somehow woven into the fabric of the universe, like the second law of thermodynamics. And, you know, therefore, you know, the idea that we could ever do anything about it with medicine is nonsense. Both of these things are nonsense, but very, very deep-seated.
So what about the other direction with that same logic, that, you know, we have a case study of things being failed and snake oil salesmen for tens of thousands of years or whatever. But now in the last few centuries, and especially in the last century, we have all these amazing, unsurmountable tasks being surmounted. We have all these accomplishments. It seems like that's the new trend. And so is that maybe scary that we're going to get to a point where we realize things that aren't just fulfilling the capacity of the human experience, but maybe break what it is to be human or something?
Yeah, so, you know, whether it's scary or not depends on the person who is scared or not, really. It's not anyone else's question. You know, I mean, if we look at, you know, dramatic, you know, step changes in technological capacity, it's like the norm. You know, I mean, look at powered flight. You know, powered flight research was completely futile until it wasn't, right? And this has been true for absolutely everything. I mean, if we look at powered flight, we can see that the time frame for predicting when one's gonna, you know, when one's technological ideas are going to come to fruition is extremely unpredictable. So, I mean, you had obviously famously very credentialed physicists like Lord Kelvin saying that powered flight was theoretically impossible right up until it happened. But let's also remember that Leonardo da Vinci was creating designs for powered flight 400 years ago, and he probably didn't think it would take 400 years to get there now to actually realize those designs. So, you know, it can go both ways. However, I mean, even though it's less, you know, documented, I think that it's very likely that the same is true for things like, you know, basic modern medicine, which of course happened again very suddenly. I had Pasteur and Jenner come along and make these very elementary foundational discoveries that led extremely quickly to the advent of antibiotics and vaccines and the decimation of the number of people who were dying in infancy or childhood or whatever. So this is what you expect in technology. It is saltatory. It happens in steps, and only the people who are really on the ground at the coalface looking at the research that's being done have the faintest chance of predicting how close we are. And even then, it's very speculative, it's very probabilistic, but it's a lot better than the predictions of people who are not at the coalface. This is particularly prominent today because one of the more vocal so-called optimists, who's actually a pessimist in this field, a guy named Jay Olshansky, has published yet again a paper that says exactly nothing more than he said 30 years ago about how it's impossible to do anything about aging, using perfectly straightforward and correct mathematics that says that it would take a big breakthrough to do anything serious about human lifespan, which is not even difficult. It's high school mathematics. But he gets it published over and over again in the top journals. And furthermore, the way they publish it is with titles of the articles that completely elide the possibility that there could be such breakthroughs, let alone the time frame in which those breakthroughs are likely. It's extraordinarily insidious. And the only reason it happens is because the editors and publishers of these journals want to pander to the pro-aging trance. They want readership, and so they want to say what the audience wants to hear. It's exactly the same as the reason why fiction in this area, science fiction about a post-aging world, is almost invariably dystopic. They say, they try to pander to and thereby entrench the pro-aging trance in the audience, and it makes my life a lot harder.
Gennady, do you want to say something first? Because I got thoughts, but go ahead.
Yes, indeed. So I first learned about Aubrey's work just a bit over 20 years ago. And in fact, I had reached out to Aubrey back then. This is my online magazine, The Rational Argumentator, what it looked like back in 2004. And I was so impressed by his work.
But not by the aesthetic quality of my slides.
Well, for 2004,
I was gonna say that's pretty based. Yeah, this is great. It looks amazing, actually.
Yes, and what Aubrey was able to illustrate via his outline of the damage repair approach is that it's not necessary to essentially slow down biological aging or understand every intricacy of human metabolism, which may take hundreds of years, in order to do something about the problem of aging. It's just a matter of reversing the damage that accumulates and the different types of damage. But what also impressed me was that the 7 main categories of damage that Aubrey had outlined were already known at that point for at least 20 years. And now they have been known for at least 40 years. And we haven't really had any major new type of damage identified. We've had different taxonomies of damage. For instance, the hallmarks of aging keep being subcategorized into different subtypes, let's say, but the universe of known aging-related damage is pretty much the same. So why can't we use an engineering approach to repair it? So that impressed me, and that led me to think, well, if we have a fighting chance to overcome this problem, then what can one do to make a contribution? And for me, unlike Aubrey, I'm not a biologist, though I did take advanced placement biology in high school, essentially the 2 semesters right before I learned about the SENS approach. And everything I learned there was compatible with what Aubrey had written about. And to me, that was a sign that, well, this is serious mainstream science. And if we have a fighting chance, then indeed, let's do something. So I've been involved in the longevity movement in some capacity for 20 years. The contribution that made me most famous was this book, Death is Wrong, which I published in 2013. This is the world's thus far only illustrated children's book on radical life extension. And the aim of this book is to get kids to realize earlier what I came to realize upon learning about Aubrey's work. Because I was the kind of child who could never accept mortality as just an inevitable fact of life that one should reconcile oneself to. I always felt viscerally that death is wrong, as I think many children do when they first learn about it. But unfortunately, that recognition is kind of beaten out of them, or let's say cajoled out of them by the culture, depending on what sorts of responses they encounter to that initial reaction. And I wanted to give children essentially some validation in reaffirming that, yes, this is an injustice. Yes, you should be upset about it, but we can also do something about it. And it matters that you get involved. So I'm hoping that the next generation of scientists, technologists, advocates are going to benefit from the writings and the outreach that both Aubrey and I have been doing. And of course, I'm also the chairman of the US Transhumanist Party. We are actually celebrating our 10-year anniversary today. The Transhumanist Party was founded on...
Really?
Yes.
Today. Happy anniversary. Crazy.
Thank you. October 7th, 2014 by Zoltan Istvan. And we stand for putting science, health, and technology at the forefront of American politics. Our first core ideal is that we desire to achieve significant life extension through the progress of science and technology. And we know it's not just about the research, it's also about having the correct policy framework to enable the research to proceed at the pace that it could, given an absence of constraints. So Aubrey mentioned funding is a major constraint. Another constraint is the amount of time it takes to get a new treatment, a new drug, a new device to market. In the US, because of the Food and Drug Administration, it takes an average of 10 to 15 years and about $2 to $3 billion to get a single new drug approved. So if there were a drug developed that could reverse some of these types of age-related damage, it may still be a while for patients to get it unless we have some significant FDA reform. So hopefully by the time the technical feasibility of these rejuvenation treatments arrives, we will also have the policy reforms needed to get them to patients as quickly as possible.
Yeah, and let me actually amplify that last point a little bit, because we are very hidebound at this point by regulatory ossification, you know, antediluvian regulatory regimes, and not just in the US, but throughout the world, really. There are some, you know, isolated bits of progress here and there, and those bits of progress need to be highlighted and expanded upon. One thing that happened last year was that in Montana, there was state legislation passed with the help and the guidance of an organization that I'm proud to have seed funded a couple of years ago, the Alliance for Longevity Initiatives. And that legislation essentially said that you can get hold of any drug that has gone through phase 1 of clinical trials, not all the way through the really expensive phase 3, just so long as you have a prescription. And you don't get insurance for it, but if you can pay for it, then you have access and you don't have to be sick. This is the clear thing. It was an expansion of federal law that already exists, which was passed maybe 6 or 8 years ago, called Right to Try. But that law said that you could only access medicines that were not all the way approved if you were terminally ill. In other words, if you had tried everything that was approved. And, you know, some of us might prefer never to get terminally ill in the first place. So this is huge. there are, of course, other examples.
Also, isn't age kind of right now a terminal illness? You know what I mean? Like it's pretty much the most terminal illness.
But it's not treated that way. Right. Now, I mean, of course, we have made progress there as well. There is progress at the FDA level in treating the overall collection of age-related pathologies as a single thing that can be described in a somewhat, mutually connected way. And the best example of this is something called the TAME trial, which hasn't happened yet, but it's been defined. Its clinical endpoint has been defined. So that's good, but it's only a little bit good because it only talks about symptoms. It doesn't talk about treatments that are preventative before you get sick. Then there are other examples of this around the world. The best one, to my mind, is something called Vitalia, which is a longevity initiative centered in a special economic zone in Honduras named Prospera. It's not strictly in Honduras per se. It's in an island that's part of Honduras, but it's off the coast. So it's a wonderful place. I spent a bit of time there. It's only, a square mile or two, but that's enough to allow a bunch of companies to be incorporated. Yes, thank you for putting that up there. It's a very big deal. I think that unless, there are real disasters at the level of the Honduran government, there's a very good chance that Prospera will, within at most a couple of years, become the global hub of medical tourism. And that will be immense for the access to new drugs and new treatments, especially for aging. And the key thing, of course, is that even though Prospera itself will only be accessible to people who have the money to get themselves there and so on, and not to pay for medical treatment through insurance, nevertheless, what it will do over time, and I would say over a very short amount of time, so long as there is success with these treatments, is it will create FOMO. I mean, a lot of FOMO. So you're going to see a huge amount of incentive for governments in established jurisdictions to greatly accelerate the modernization of the regulatory regimes that exist today and that are, built on the basis of a very different situation in medicine.
Do you see it possible that some government might target, embargo Prospera, something to try to make it more difficult? Is it being treated like that?
Not really an option. There are international treaties around that.
That's awesome.
I will say the greatest threat to Prospera right now is from the government of Honduras. And the government of Honduras is controlled by Xiomara Castro, who is kind of a socialist politician of the Venezuelan model, and she doesn't like the idea of alleged foreign capitalists essentially, quote, exploiting the Honduran people, even though the Prospera organization has brought in considerable opportunities in terms of employment, in terms of upward socioeconomic mobility for the residents of Roatan. But there are some fairly strong protections in the legislation that enabled these special economic zones in Honduras. When I was at Longevity Summit Dublin, which, by the way, the LEVF, the Longevity Escape Velocity Foundation, provided the bulk of the funding for, I interviewed Trey Goff, who is a spokesperson for Prospera. And he and I had a lengthy discussion, about a half hour, where I asked him about all of the nuances of how Prospera was set up as a legal entity and what kinds of threats could exist to its future. And he talked about the potential threat from the Honduras regime, but at the time he didn't consider it to be as significant because he thought the Castro administration would be defeated in the next election. Unfortunately, what seems to have happened more recently is that the Supreme Court of Honduras, which isn't as separate from the executive as the Supreme Court would be in the United States, essentially issued a ruling that is more of a threat. And that's an ongoing situation right now. But the people at Prospera have been rallying support on X and on other social media for people to speak up and protect the rights of those who are innovating in this special economic zone.
And what about gatekeeping? I mean, just generally, more generally, Aubrey, do you feel like there could be a push to gatekeep this technology for a few people that are the elite right now?
Absolutely no chance. The work that what we've been talking about so far about Prospera and so on concerns the development of these technologies, which are yet to be, accessible to anybody because they don't yet work, right? Or they only just work, and we only want that, and the only people who will want to access them are the early adopters. But what you're talking about with this question is the access to things that have got far enough along to that basically everybody's happy that they're safe. The question is, can they access them? So this question comes down to economics. I wish it wouldn't. I wish it would be just a case of the humanitarian imperative that, death is bad and aging is bad and all that, causes suffering and all that. But even for decision makers who pay no attention whatsoever to the humanitarian imperative, there's the economic imperative. The fact is, right now, today, when these therapies don't exist and therefore nobody has access to them, we are spending the overwhelming majority, like 80 or 90% of our medical budget on the health problems of late life, right? And if we didn't let people get sick in the first place, that wouldn't be the case. So even in the early stages, when these therapies are inevitably going to be fairly expensive, they'll be far less expensive than the alternative of not providing them, which means from a purely mercenary economic perspective, governments are going to find it an absolute imperative to go out and do the front loading of investment, whatever's necessary, the building of infrastructure, the training of medical personnel, et cetera, so as to make sure that these treatments are available, irrespective of ability to pay, to absolutely everybody who is old enough to need them. These therapies will simply pay for themselves many times over really, really quickly. And if you look at the mechanics of that, obviously it depends on the country. Like, it'll be the mechanics, the details will be different in the US with a private healthcare system and insurance-based reimbursement relative to a single-payer system like you would have in Europe, for example. But that doesn't matter at all. Fact is, any way you cut it, the money will be there, and therefore it will be shared out equitably across the people who have the IP and the people who, and everybody will benefit. There is absolutely no question. And of course, the only question is, will the decision makers, the governments and so on, actually understand what I just said at the time, when these therapies come along? But you can be bloody sure they will. Not just because I've been saying it for the past decade, but because I won't be the only one saying it. These therapies will not arrive tomorrow, right? They will arrive, gradually over the next many years, like 10 or 15 years. And during that time, governments are going to wake up and wake up and wake up and listen to people like me who are pointing out this bleeding obvious argument, and they won't take long to get it.
Yeah, I mean, it's exactly what happened with smoking, right? There's this is crazy how much money we have to, not even in America where there isn't social health care, how crazy expensive it is for corporations to do healthcare and everything else just because people were smoking. It's eventually they stopped it, right? But what do you want to talk about RMR study 2? You want to get into the mice?
Of course. I can talk about RMR
this is a fun one for me, I think, because, you got the Answer 42 and the Hitchhiker's Guide to the Galaxy. Everything comes down to mice, it seems like. But you're not allowed to do these studies we talked earlier because of gatekeeping and experimentation. Humans, in general, you're not experimenting on humans, right? You have to do this with animals. So what's the deal with the RMR study? What are you doing with mice?
Yeah, well, we're being very careful not to use white mice, which were the mice in the Hitchhiker's Guide. We are.
You don't upset yeah.
Right. No, we're using a strain that's been used in the large majority of lifespan studies over many decades. It's called C57 Black 6. These are mice that live normally to about 2.5 years. And what we'd like to do is figure out ways to extend their lives, of course, their healthy lives, and therefore, as a side effect, their total lives, by as much as we can, but only by starting late in life. So starting when they're already 18 months old, so 1 year away from their average lifespan. And if you do that, people have been trying to do that for a while, and the best that they've been able to achieve in terms of how much they were able to extend life when starting at that kind of age is about 4 months. So our goal is to get them out to an extra year rather than only an extra 4 months. So it's trebling the effect size, the impact of the interventions. And we are very sure that the only way that this is going to be possible is with a divide and conquer approach, essentially by giving these mice a whole bunch of things at the same time that address different aspects of aging, different aspects of the damage that the body does to itself throughout life. So our first experiment along these lines began early last year. It's not quite done. There's maybe a few dozen mice left out of the 1,000 mice we began with. But it's definitely validated our hypothesis that this is the right way. This is the right kind of experiment to do. I believe honestly that it is by some distance the most value for money type of experiment that can be done right now, even though these are very expensive experiments. This experiment cost $3.5 million. Because 1,000 mice, right? And we're injecting them with cells and viral vectors and so on. So the ostensibly bad news is that we have not knocked it out of the park at the first attempt. We have only barely got to the kind of level that other people have got to with much simpler approaches. But, I'm not complaining. We've learned a huge amount from this experiment. The only thing that's slowing us down right now is we don't have the money to do the next experiment. If I were given $100 million today, I would spend $90 million of it on experiments of this overall design, with with different interventions combined, with the same interventions at different doses, things like that. And I'm very sure that would take us to this milestone of getting a year, which I've called robust mouse rejuvenation, pretty quickly. Now, why is that milestone so important? The fundamental answer is because it completely destroys any pretense that aging is some kind of thing that we can never manipulate properly with medicine, that we can only tinker around the edges. Even though there may still be a bunch of work, and I estimate a decade of work, to get from that point to the corresponding point in humans, which is what I've called longevity escape velocity. Nevertheless, that tinkering is going to be done in earnest. There will be a proper war on aging by the time triggered by getting as dramatic a result in mice as what we're going for. So that is my rationale for prioritizing these experiments with the small amount of money that I have been able to scrape together, and why I will want to spend as much more as possible.
Wow. So do you think that this study is going to lead to something that shows that it's a stack lifestyle, that we need certain things, multiple things that interact with each other? Is that going to go?
You could call it a stack, yeah. I mean, the whole idea that I put forward 24 years ago, the idea of damage repair being the way to go, being easier than slowing down the creation of damage, which is what everyone had been thinking about before, that whole idea is intrinsically a divide and conquer strategy. It says, well, okay, look, the human body is a machine, therefore its function is determined by its structure, and to the extent that we can restore an old body's structure to something like how it was in early adulthood, we will thereby extend healthy lifespan and therefore total lifespan. That's fine. But the fact is, because the human body is such a viciously complicated machine, it does itself an insane number of different types of damage. So the only reason that this ever became even slightly, practical was because when I put this idea forward first in 2000, I realized that we could classify those many, many types of damage into a relatively manageable number of categories, just 7 categories. And the classification was for the purpose of identifying and describing generic approaches to fixing those types of damage. So that's where we've been all this time, but it still means you've got a whole bunch of different treatments that you've got to develop to give to the same mice and then eventually the same humans at the same time. So yes, you can call it a stack.
I gotta ask you some questions about some of the bigger, more interesting treatments. But first, I think Janani, did you have some questions about this? I know you've been keen to ask him about the RMS.
Well, I wanted to point out that Aubrey has done something remarkable with regard to how scientific studies are usually communicated to the public, in that he has published these regular updates about once a month, sometimes a little more frequently, sometimes a little less frequently, but he has published them on social media to show how the experiment has been progressing thus far, and especially the survival curves comparing all 10 of the cohorts, the control cohort, then the cohorts that receive one treatment each, the cohorts that receive 3 of the 4 treatments each, and the cohort that receives all of the treatments for males and females, and what their survival has been across time. That has been very interesting to follow, and Aubrey has provided some detailed commentary, and I think this has really helped get the community engaged and get people to understand and be excited about this research, because all too often scientific studies, even very important ones that communicate valid insights, are published in journals, and then maybe 50 people read them. And yes, some of those readers are also experts in the field who can cite them and build upon them. But the vast majority of the public remains unaware of all of the excellent work that's being done. And I wonder, Aubrey, in the course of essentially preparing these updates and following the results of the RMR1 study, what are some insights that you can communicate that you've learned from this particular study, perhaps insights that you didn't anticipate, or perhaps the magnitude of results for certain cohorts surprising you in any particular way?
Yeah, okay, so let me actually address, first of all, what you said very nicely about the communication, and then answer the last part of your question. So on the communication side, yeah, I mean, it's been invaluable to me to be able to come out and actually give these interim reports every month or two. And that's not true only in the sense of, you know, it's helping to maintain enthusiasm and interest and so on in the wider world. It's also because actually the main thing about publication in the academic world is not so much that very few people read a paper. That's not always true. If the paper is high profile, it can be widely read by the general public. The problem is how long it takes to actually do it. The fact that one has to, you know, keep things embargoed until the publication is out. And of course, the publication is only out after it's gone through all the peer review and all that. So it takes fucking forever. So, I mean, the way I've been able to avoid that is very straightforward. Namely, in academia, your average professor, he's got a team of people who are all looking for their next job. You know, they're all PhD students and postdocs who are thinking about their careers, and therefore they've got to get credit. So publication priority is really key, even to the extent that it's not so key to the professor who's already tenured or whatever. People who work for me are not looking for their next job. That's absolutely critical. Furthermore, you know, it's different from working in the private sector. If I were working in the private sector, I also couldn't do what I'm doing now in terms of putting these regular reports out, because you've got to worry about your bloody investors who want to protect the intellectual property and they want to get a return on investment in the fullness of time, which is perfectly fine, but it's the reason I didn't do that. You know, a lot of people take pity on me for having had to take a lot of slings and arrows over the years, but the fact is I did it with my eyes entirely open. I chose the heretics path in life, you know, for a reason. So yeah, that's very important. So then to come back to the last part of your question, Gennady, what the results are saying to me now. Well, I want to be a bit cautious about this because there's a lot of things that results cannot say to me until the experiment is completely over. At this point, pretty much everything that we can say is extremely tentative. But I will say that overall, I'm not very surprised by anything. I certainly wasn't expecting that we would, hit it out of the park at the first attempt. I knew that there would be a whole bunch of reasons why that wouldn't happen. I did not know what those reasons would be. I didn't know which bits of the experiment would work and which bits would not work. However, I was hoping that most of the bits would work, and sure enough, that's what has happened. We are seeing, certainly in males, clear additivity of the interventions. We're seeing in females a slightly more disappointing result in a way, namely that the main benefits are being conferred by one treatment, namely rapamycin, which is not actually a damage repair treatment at all, and that the 3 damage repair treatments are not really adding all that much to that. But even that is, an oversimplification of what we're seeing. So I will want to, to say a lot more than that in due course. And then, looking at some of the other anomalies in the data, we've got cases where large numbers of animals die very suddenly over a period of like 2 weeks a few times. And we're going to have to do careful statistical analysis to ask whether, if we take into account the multiple hypotheses that we're testing, whether that really does fall outside of the bounds of statistical significance. But then, there's other cases where over the long term, things have gone weirdly, like, groups that have done worse than the controls, even though they were getting 3 out of the 4 treatments, and then they've caught up, over time. So pretty curious results that we've had. But this is what you expect with highly complex experiments like this. So we're learning a huge amount from this. We're also, I'll be honest, learning a lot about how to do such experiments. There have been a couple of ways in which we are having to conclude that we didn't do this or that thing quite as well as we could have done. And obviously next time we go, we will benefit from that knowledge, that learning. So, it's pretty much what I would have expected overall.
Do you feel would it be okay to talk a bit about like inhibiting the mTOR, or do you want to keep that for another time?
Yeah, I can talk about that. No problem. So yeah, sweet. mTOR. Well, it's this complex. I think really the right way to talk about this is just to talk about rapamycin more generally. Yeah, rapamycin appears to work as a calorie restriction mimetic, and it works in an unusual way. Most calorie restriction mimetics work at the level of the mitochondria in one way or another. They work by inhibiting the access of nutrients to the mitochondrial respiratory chain, and that allows them to, to trick the cell into thinking that it's in a famine when it isn't. It's not getting enough calories. Rapamycin works outside of the mitochondria. It works in the cytosol, and it inhibits protein synthesis. And that makes the cell think that it's not getting enough amino acids when it actually is, right? So that turns out to have the same kind of effect, but rather more powerfully than inhibiting the respiratory chain. So yeah, it's clearly a good thing. And we're using it in our current experiment because it works, right? So
you have good feelings about it.
Yeah, but it's not damage repair. So one thing that we've pretty much decided upon for RMR2 and beyond is that we'll just give everybody rapamycin. We won't test it, it's proven. We will use it as the backdrop overlaying which, on top of which, we will test other things.
Okay. And you mentioned another one of the, let's say, amenities that you will be giving all of the mice for RMR2 will be exercise wheels, so that you can control for the effects of exercise on their longevity.
Right, same applies. The thing about exercise is that it, of course, it actually, it's good for you. And indeed, in mice, exercise seems to be very important. Mice that are happy tend to run a lot when they can. So running wheels are often put in the cages. We didn't do that this time for reasons of budget, but we feel we probably should. One suggestion that's out there is that we should do the same thing for exercise as we're going to do for calorie restriction. In other words, rather than doing the real thing, we should give them a mimetic. So rapamycin tricks the cell into thinking it's not getting enough calories when it actually is. Similarly, with exercise, you can actually, kind of trick the body again. But this is not very well, characterized, not characterized well enough. So I suspect that we won't do that. We'll just do the exercise thing. We'll give the running wheels per se.
So maybe it's a safe way to talk about it, to talk about some of the general problems that you see in aging that need to be tackled, right? Like senescent cells or amyloidal plaque or things like that. Maybe you could talk about things like that. Like, what are some of the challenges we all have to face?
Well, I mean, this is what SANS is, so I probably shouldn't spend too much time doing that because it will just be a regurgitation of what I've been saying for 20 odd years.
Right.
But yeah, I mean, the main thing I guess I should emphasize is how much progress has been made. It is extremely gratifying that all of these things, even the most challenging ones that nobody would dream of working on, even in academia at the time I came along, we've managed to get them far enough forward that they've been spun out into startup companies, or in some cases, companies that came along independently of my foundations. So that's great. People who actually want to make money are feeling this is close enough that that they might actually be able to. It's very heartening.
Yeah. Okay. So then also in terms of breakthroughs that you've seen like that, is there some things that stand out as really impressive that you've seen happening around you? It might actually be a big help.
I mean, it's impossible to pick and choose, really. There are breakthroughs coming up all the time. I'm mostly interested, of course, given everything I've said so far, in reports where a particular intervention has been able to extend mouse lifespan when started in middle age. This is important because the way that we chose the interventions for RMR1 was precisely that. We said, okay, we want to use things that individually have been shown by other groups to actually work. Only modestly maybe, but to actually work. And the theory is that if we put a bunch of those things together, so long as they they are assumed anyway to work in different ways, then we should get some degree of additivity. And that's exactly what we're seeing, at least in males, in this experiment.
Now, Aubrey, you had mentioned before that until about the early 2020s, funding was the main constraint to the rate of progress. And then certain events in the early 2020s led you to be a bit more optimistic about maybe there finally being enough funding for the research to catch up with your previous time frame. And you had pointed out that talent was now the biggest bottleneck. But subsequent developments have also led you to think that perhaps some of this new influx of funding is being misdirected. So I wonder if you could perhaps explain to the audience where you think the risk of misdirection arises from, how the funding might be misdirected, and what would be better ways to direct it given all of this recent enthusiasm for longevity.
Yeah, thank you, Gennady. So it's true. I mean, I will go back a little bit beyond the early 2020s. I would say it really all began in the mid to late 2010s when the private sector component of this movement emerged. When you had, in particular, Michael Grieve, among others, come along, Christian Angermeyer was another one, and put proper money, 8-digit money, 9-digit money into companies that were pursuing really long-term, early-stage research, a number of which were spin-outs from my foundation. So that was extremely heartening. And as time's gone on, especially in the, as you say, the early 2020s, what we're seeing is much bigger money, 9- and 10-digit money, being spent in this field. We know all the examples, Altos being funded at a level of $3 billion by Jeff Bezos, 180 million from Sam Altman into Retro, 100 million from Brian Armstrong into New Limit, things like that. This is extremely heartening. But there is a caveat, which is that this money is extraordinarily unevenly distributed. It's not going to the hardest things, the most challenging areas, and the perhaps least profitable areas, least profitable in the near term. And that's critically problematic, because the fact is this any divide and conquer approach to anything, you can't leave a component out. The thing's just not going to work, right? So we've got to fix this. Very recently, I heard the absolutely tragic news that Michael Grieve has done a 180 on funding, and he's actually not going to carry on putting money into the various companies that he's been supporting over the past few years. This is, an utter bombshell, and I'm speechless about it, because I always thought that he was in it for the long term. I have no idea what's going on there. I'm very much hoping I can have a word with him, but I very much doubt I can change his mind. Nevertheless, it's a tragedy of epic proportions. But yeah, the reason I'm working still in the non-profit sector is because it's needed. There are areas that are just pre-investable or non-investable that are every bit as vital as the areas that investors have picked up on. So yeah, it's a mixed bag right now.
How about with AI? Because I love that you're always working to debug DNA. So do you feel
let me talk about that, because that's another problem that's happened right now. Some of the biggest funders of this field, including Sam Altman, have, as far as I can tell, decided that they don't want to put any more money into wet lab work, into actual math experiments and so on, because they believe that AI is moving so fast that it's just going to do the job, and their best bet, the best value proposition, whether for them to make money or for the aging to be defeated, is simply to throw themselves all into AI to accelerate it, so that it will just magically figure out what to do. And my take is that's very, very short-sighted. That basically, yes, AI is wonderful, and it's proving to be more and more wonderful every week, but that it needs input. It needs data to start from, because we're talking about the real world here.
We've forgotten how wonderful white lab work is,
And the so we still need to grind away doing these wet lab experiments in order to give the AI the substrate with which to tell us what experiments to do next or what treatments to develop. And if people are just not forgetting that, then that is also going to slow things down.
How do you think the talent pipeline has evolved during the past few years, especially given the arrival of the Longevity Biotech Fellowship, which you had a role in funding?
Yeah, so in 2022, I had the great good fortune to have a bit of money to spend, because Vitalik Buterin had donated $10 million to me. And I used it, I would like to say, extremely well. I funded probably, more than half a dozen really important initiatives. And one of them was the one you just mentioned, Gennady, the Longevity Biotech Fellowship. Specifically, I funded the component of that is focused on retreats, on these 5 or so day things where maybe 50 or so newcomers to the field are brought together to learn from from a dozen veterans, but also to make connections with each other and to figure out the most impactful way to join the crusade and the movement. This has been absolutely indescribable success. I'm so proud that I was able to seed fund it, it's continuing to be that way. Before that, people would come to me all the time just because I've got the biggest network, I'm well known, and they would write to me and they would say, hello, I'm interested in this field, I'm committed, I'd like to get involved, but I haven't the faintest idea how. And I would ruminate and think, and I would say, okay, maybe you should talk to this person or that person. That doesn't scale. I do a lot, very well behaved with my email, but fact is, there's only so much that one little person can do. So this is basically a scaling of that. It's bringing These things happen every few months now, these retreats, and it's bringing people into the field in a really, really fantastic way.
That's awesome. So also in terms of in terms of AI even, or just tech hopefulness, do you see how much closer do you think AI has brought us towards like really decent drug discovery, but also more importantly, how much more hopeful are you for gene therapy than you were like 4 years ago?
Well, okay, so let's do both of those things. So I wouldn't even say that one is more important than the other. On the drug discovery and such like, we have huge progress. I mean, in silico medicine is the kind of poster child of all of this. It's a big company now. It's pretty much a unicorn. It's really leading the way in developing drugs based on AI and and its value proposition is that it can identify drugs that actually work, that succeed in clinical trials in a tiny fraction of the time that it takes to develop such drugs the normal way. And there are a number of other companies who've gone in the same direction. Then we have to take into account the companies and the advances that are being made that are not specific to aging, that are all about biomedical research in general. So, of course, the poster child for that for the past few years has been AlphaFold, this fantastic program from DeepMind that predicts predicts is almost not the right word anymore, because it more or less tells you the three-dimensional structure of a protein based on its amino acid sequence. And as many of you will know, in the audience, in the past few weeks, DeepMind have announced a new thing called Alpha Proteo, if I remember rightly, which is the first step towards not just predicting the structure of a protein from its sequence, but going the other direction, namely, identifying proteins that could be useful, that could have particular, desired catalytic activity as enzymes, for example, by starting with what shape they need to be and going from there to figure out what amino acid sequence would fold into that shape. This was the obvious next step, as we all knew a few years ago, and it's absolutely wonderful that they've been able to get this far enough to be able to actually talk about it as quickly as they have.
Right. Yeah. So what do you think about that? You think that, you kind of answered this already by saying neither one is more important, really. And you see drug discovery as being at least on par with gene therapy.
So I haven't got to gene therapy yet. I'm only talking about proteins so far. So, of course, the big thing with gene therapy is not actually what genes you deliver, it's how you deliver them. That's the hard part. Getting them in the desired quantity to the desired cells. And that is still an area where AI probably hasn't come into its own, at least not as far as I'm aware. But other things very much have come into their own. So you've got a whale of technologies out there now that are delivering large molecules like plasmids, for example, with DNA in them, into cells in a manner that's much more efficient than anything that existed even a few years ago.
Right. Maybe. What do you think? Do you think Twist is doing anything interesting with that? What do you think about Twist?
There's no real point in identifying particular companies. I'd be here all night, right?
Fair enough.
So much, and this is really important. People always are terrified of overpromising and under-delivering, and the market getting skeptical and all that. And bad things have happened to a few companies, especially companies that went public too quickly in the past few years. But honestly, I'm not worried at all. And what I just said is why I'm not worried. If we go back 20 or more years, we can look at the story of the tissue engineering industry. That was an industry that came out of academia into the private sector and basically crashed and burned. Virtually no companies that were created back then survived. And that was basically because the science wasn't ready. But the science was built on a very small number of principles. there were, a bunch of ideas that were not ready for prime time, and, people jumped the gun and it just didn't work, and, the whole thing collapsed. But here we have this very large amount of diversity of ideas. So yes, there will be company failures. That's in the nature of the job, right? But absolutely no chance, in my view, of the industry overall being, losing investor trust, because there's just too many options.
Now, in terms of gene therapy, do you think there's a significant prospect of scaling the gene therapy treatments and bringing down the costs over time? I know that back in the late 2010s, Bill Andrews was telling me how he had prepared a protocol for an experimental gene therapy to treat aging, and he was focusing on Alzheimer's disease, but each administration of the gene therapy would cost about $1 million to prepare. So he needed essentially a wealthy celebrity patient in order to have any sort of actual experimental data. And that was where he struggled to actually find somebody who was willing to take the risk on that gene therapy, even though some of those wealthy celebrities did have Alzheimer's disease. It wasn't that he, at the time, lacked the means to actually administer the treatment. It's just he was marketing it to such a small population that he wasn't sure he would have any takers. So do you think it will be possible in, say, the next 10 years to reduce the cost to, say, $10,000 per administration, which would be a lot more affordable to, say, middle-class people?
For sure. I mean, I think it's not a matter of thinking. There's no question that's going to happen. The technologies are already there, really. It's a case of, what is the basis for that cost in the first place? It's the innovation, right? The innovation costs a huge amount of money. And once the innovation is done, the money gets, the cost will plummet every bit as quickly as the cost of sequencing a genome plummeted, if not faster.
Well, I know we've been an hour, so I don't know if I can ask you one more question, really. Maybe Janani, you got one more? Is that all right?
Well,
before I do?
I think the one question that I would ask is in regard to all those people who think that advances in reversing aging would lead to some sort of great societal inequality or stratification. That's probably the biggest objection that we're seeing, especially from the younger generations. How would you respond to that, given the discussion here, especially your comments about the cost coming down over time, your comments about governments being incentivized to make these treatments available? Can we put the nail in the coffin of the argument that these treatments will increase societal inequality?
Yeah, well, the thing about zombies is it doesn't matter how many nails you put in their coffin, right? I had the same situation with all of these classical arguments, like, oh dear, where will we put all the people? Or, oh dear, won't dictators live forever? Or, oh dear, how will we pay the pensions? Or, oh dear, doesn't death give meaning to life? The fact is, we have to ask ourselves why people just insist on letting the obvious answers to these questions go in one ear and out the other. And the answer, of course, is very straightforward. It's the pro-aging trance. Who was it? A famous American wit, I've forgotten his name now, said it's very difficult to persuade somebody of something, to get someone to understand something if his salary depends on not understanding it.
Upton Sinclair.
Thank you so much. Very good. And of course, in this case, it's not the salary, it's the, worldview. It's much bigger than the salary. People just can't get their heads around the idea that they ought to think about a world where aging doesn't exist outside of science fiction. And they don't want to, because they don't know how soon it's going to come. They know that if they have the opportunity to avail themselves of such technology, they certainly would, but they don't know how soon that technology is going to come along, so they don't want to get their hopes up, as I said earlier. It's all about that. So it's a psychology question. It's not an argumentation question.
Well, I can't help myself. I'm going to keep it general because I think at some point I might just bother you in a more private conversation, but like publicly, just publicly, how close do you think we are to extending?
I'm perfectly public about this. So of course I always insist on emphasizing that my predictions are probabilistic. So my predictions are all about how soon we have a 50-50 chance of getting to a particular milestone. But the milestone that I always focus on is, of course, longevity escape velocity, this point where we are able to postpone the health problems of late life sufficiently to give ourselves time, to buy ourselves time to make the next step, and then the next step, and so to stay one step ahead of the problem. And I believe that currently we have a 50-50 chance of getting to that point within the next 12 to 15 years, so the second half of the 2030s. Now, I still think that there's at least a 5% chance that we won't get there for 100 years, because we have no idea. This is pioneering technology. We have no idea what kind of unforeseen obstacles we might encounter. But who gives a damn? The fact is, a 50% chance is quite enough to be worth fighting for.
I think I'll take it. That's pretty good. Let me share some links for you really quickly. I want to make sure people know that they can find you. I know you got the LEV Foundation on your site right there. If you want to check out the LEV Foundation, everybody.
Also, and there's a nice friendly donate button at the top right.
Yeah, right. Everybody should be donating to, if you want to stay alive, right? Melt down your jewelry.
This guy here, let me talk about this guy here. This is Didier Colonel. Cool. He is not massively wealthy. He's probably got 7 digits. And he's donated maybe 1% of his wealth each year for the past several years to my work. Real hero. This year, he's donating probably 10 or 15% of his wealth. I mean, a huge amount.
Enochian tithing right there.
Right.
Well, I'm sorry, I didn't mean to interrupt. Did you want to say more about what?
That's the money. That's the money slide, right?
Yeah, I feel like people should be doing that.
This guy is leading by example in a big way, and he is matching any money that anyone else provides through the whole of October. So, anyone who donates to us, you're doubling your money.
Oh, that's pretty based. Okay, yeah. So if you're, this is a really serious group of people that are doing actual studies that are going to probably help you live a lot longer. I would recommend looking into this and helping any way you can. No joke. Also, make sure you go to his X and check out Aubrey's posting all the time about things that are happening. You can keep up to date on all of these slides and everything that's going on as much as released to the public, which is sometimes a lot, to be honest. Good job with that.
Thank you.
Thank you very much.
This is the most transparent scientific work that many of you will ever see. So yes, I strongly encourage donating to LEVF and supporting this research in any way you can.
Epic. Well, thank you very much. And Gennady, thank you for being here. And happy anniversary to the United States Transhumanist Party. I should probably just put that up on the screen too. Transhumanist Party. Good job that you guys did that.
Yes, indeed. 10 years. That is a long time for an organization. That is when an organization can legitimately call itself an institution. And that is what we will strive to become in American politics. It is free to join, by the way. You can sign up on our website. It takes less than a minute and become one of the more than 4,400 members who call themselves transhumanists at present. We would be thrilled to have you. Whatever your particular partisan or nonpartisan political persuasions may be, as long as you care about building a brighter future, we want you in the ranks of the U.S. Transhumanist Party.
Well, Aubrey, is there anything else you want to close us out with? What about a call to action that you have?
Well, the call to action is, write me a last check, really. I mean, the fact is, I have the best team I've ever had. I've got the most focused and most important experimental program, lab research program that I've ever had. This is the time to really, lead by example.
Everybody, I hope you heard it. Let's get in here. Let's get as much out of humanity as we can. Humanity plus. Thank you very much for being here. See you next time.
Live long and prosper.
This next story has been suppressed by mainstream media. Let's go to Andreas for more.
Everybody, tune in to Recent Tartarians.
Recent Tartarians. Recent Tartarians.